How do we know?
That's a great point.
The federal government, the CDC does not track SOGI data when it comes to COVID-19, right? We actually don't have a lot of data except for the occasional New York Times article about long COVID, for example. We don't have a lot of data on the health disparities of the queer population from especially federally funded sources or the government, right? We just don't have data on how LGBTQ folks in general have been affected by the pandemic. And as we've said, we know that rural LGBTQ folks and just LGBTQ folks in general face so many disparities, and that's only going to be amplified by COVID. We know that LGBTQ folks in general just don't have primary care providers, right? And if you're not getting routine health maintenance, then you're probably not you're not as likely to get help if you have COVID or are suffering symptoms that are long lasting or effects after having been infected with COVID. There might be chronic conditions coming up that really are not being managed. And there's less of an access point to get access to a vaccine, right? So we don't track this data, but I would bet that LGBTQ folks are less likely to get vaccinated too. Not because they don't want to get vaccinated, but because they don't have the access.
Yeah. I think focusing in on in pediatrics, I've seen two things during COVID. One was for the trans kids I've been taking care of, and actually all of the LGBTQ youth I've been taking care of, who are in non-supportive environments at home. They've been in that environment 24/7 for the past year because they're not going to school, they're not going to their after-school programs, and hanging out with the other kids who call them the name that they use and affirm their gender with their pronouns, and help them dye their hair purple and stuff like that. And in general with youth, we've seen huge increases in mental health issues over this. And I think LGBTQ youth have been affected a lot there. I'm going to tell you though, the other thing that I actually find even sadder is the number of the trans youth who I take care of and have taken care of who did better during the pandemic because they were at home around parents who affirmed and protected them, whereas when they were in school, they were being bullied. It has been amazing to me, the number of kids who come in and are like, oh yeah, I'm getting straight A's now, who were failing before, because they don't have to be scared. And I have to say, I can't decide which of those things is worse. Is it worse that things are worse when you're stuck at home, or is it worse that things are worse when you have to go to school? They're both horrible. And it really does show the need for just meeting and accepting our youth wherever they are, whether it's at school or at home.
And I think that's why one of the reasons why Trans Health Northampton exists, right? To do that education in those school settings, to do that advocacy work, to let people know this is just a normal experience of human development, to also create community so that if those things take time to change, people still have a space here.
Yeah.